Hello YouTube viewers and welcome back to Therapeutic Tuesdays. I am Movement Mike Nimchek, and today I wanted to go over the restoration and improvement of the knee joint itself. How to restore its full function, reduce the pain or inflammation that may be in the knee, and also something to help improve the range of motion, mobilizing, and just overall improvement of the knee joint. So let's go ahead and get right into this. So as you can see, I have 3 different utensils that I want to go over today. You have the tennis ball, the lacrosse ball, and then what I have here is it's actually just a bicycle tire inner tube that I cut down the center and kind of opened it up and created a kind of stretchy band. So you can buy these on like mobility wad sites. There is the mobility wad that Dr. Kelly Starrett started, and he sells these things. But there's also a lot of other companies that have come out with them in the past year or two as well. So these are the 3 things that I'm going to be showing you how to use today. A little workshop, so to speak. So we'll start with the least menacing of them all, or I guess I personally think is the second least menacing of them all, and that is the tennis ball. Now, a lot of times people have this issue with like a clicking in the knee, or there's some kind of like it's jammed up. There's too much compression that's happened with the knee. So the way in which you can do this is you can sit in a chair. I prefer the floor. I try to stay out of chairs as much as possible. So I'm going to put this in the, I guess you call it the knee pit. You have like an elbow pit, you have an arm pit, and you have a knee pit, the back of the knee. So you just want to kind of put it in there, and then once it's in, it's squeezed, you want to pull your leg or your calf towards the back of your leg. And you can hold it here. I would do this for 60 seconds and work your way up to 2 minutes. Because this is going to be quite intense if you've never done this before, especially at the top of the calf area. Most of us are pretty darn tight in the calf. So you can see I'm kind of messing around, I'm doing some flexing. You see my toes come up off the floor and relaxing techniques. I'm breathing deeply in through my nose and out through my nose or out through my mouth. Trying to keep that breath consistent and not erratic or all over the place, short, trying to keep it a good cadence, a good rhythm of breathing, and not breaking that rhythm or that stride of breathing. So after about 60 seconds to 2 minutes, you can kind of release that and see how that feels, right? Now this exact same thing can be done with the lacrosse ball. It's a little more intense. So I would start with the tennis ball and I would move up into the lacrosse ball. It's a more firm surface. It's quite a bit more intense. And it's the exact same thing. And moving on to the other part that you can use for this. If you find a certain point, I'll show you on this side of the knee, how you have the quadricep, how you have that teardrop that comes right to the inside of the knee here. That's often a place that gives the knee a little bit of trouble. So often I'll have, and this is where I usually implement the lacrosse ball. But again, this is your first time doing this, you can use the tennis ball. I'm going to go ahead and use the lacrosse ball because I prefer it for this certain exercise. And so I'm applying pressure to the area that is most sensitive, or that gives you the most discomfort feedback, the most uncomfortable. And you're just kind of kneading around there, applying pressure. You can flex and relax that quad muscle. Again, 60 seconds up to 2 minutes in that window there. Third thing is going to be the front of the knee, or the suprapatellar pouch. Now what this is it's right above, again I'm going to use this knee, it's right above the kneecap or the knee joint itself, and if I'm not flexing, there's flexing, you can see the pocket in here, and there's not flexing, you can still see the nice indentation right above the kneecap here. So you're going to take your tennis ball, right, knowing where that area is, so it's in that exact same spot that I showed you, and all I'm doing is trying to put as much of my weight into that as I can, and I'm flexing my heel back towards my butt, right, coming back. And with this one, it's dynamic, it's movement based, so you're going to continually be moving through this, and you'll feel the muscles kind of sliding over the surface of this tennis ball. And that's exactly what you want. You're trying to break up these sticky, tight tissues or muscles. Again, same time frame, 60 seconds up to 2 minutes, and then you can switch sides. Last but not least, we are going to be using the compression wrap. And so you want it, I'm going to do this standing up. So you want to get a good amount on here first, right? There's the end of it. You're going to wrap it around, getting some tension, right? Some tension, some more tension. And then eventually, you want to have a little bit of an opening or a crease so that you can still bend your knee. And so you just keep going, keep going. This is from a mountain bike, so it's a, what does it say on here? It is a 26-inch tube as far as the circumference goes. And so when I'm done, I'm going to fold this right here, like in half, and then take one of the layers, peel it back a little bit, and then tuck this under. And tuck it right in there. So now you have a very secure compression band happening here. And now I'll show you, I'm going to try to straighten and bend. And it's going to be a little uncomfortable on the skin, but that's a very temporary sacrifice to make to improve the function of your knee. And you're trying to squeeze it as tight as you can and then extend it back out. So what you're doing here is, I'm going to continue doing this while I'm talking to you, but what you're doing here is you are restricting the blood flow to this joint. And then, after 60 seconds or 2 minutes, depending on where you're at with this as far as experience and really tolerance for the discomfort, you take this off and you get this rush of blood back into the area. And it should allow for a higher amount of blood being sent into there. The squeaky wheel gets the grease kind of scenario. And it should help with the lubrication of that joint. Now a little bit of word of caution. When working with these different exercises, just be aware of any sensations. If you've had any sort of serious knee injury, an ACL, an MCL tear, If you have had a meniscus tear, anything that has happened with the kneecap itself, the patella, these are all things to take into consideration and to be very much aware of, have a high sense of body awareness. And I've talked about this before, how there's a big difference between sharp, stabbing pain and just general discomfort, like a bruising, or just, as the best way I can describe it is soft versus sharp. Sharp is a no-go. That means there's something wrong. If it's a stabbing pain, cut it out. If it's a dull pain, a soft pain, okay, that's what we're looking for. A dull pain or a soft pain, something that's uncomfortable, but it's not stabbing, painful, intuitively feeling like something bad is going to happen. That's the biggest difference. So just being very aware of that. There you have it. 4 different exercises to do to help improve the health, mobility, and stability. Well, not really stability, more just health and mobility. We'll get into the stability for your Workout Wednesday coming up very soon. Thank you all for staying tuned today. If you have any questions, comments, concerns, want to see a certain topic talked about, introduced, and or explained, please do not hesitate to get in contact with me. I have many social media platforms down below in my description. If they're not there now, they should be there within a couple of days. I like to try and get in there and update it as often as I can. You can also hit the subscribe button and or leave a comment on this YouTube video channel. Hopefully you guys can start implementing this if you're having issues with the knee or know somebody that is having issues with the knee. If you could please share this with them as well. I look forward to seeing you all next time. Until then, keep going and keep growing. Physically, mentally, emotionally, and spiritually stronger. Peace. Hello YouTube viewers, and welcome back to Therapeutic Tuesdays. I am Movement Mike Nimchek, and today I wanted to go over and discuss a little bit about the tennis ball or lacrosse ball and